Welcome back. I'm Dr. Ahmadi. I'm a foot and ankle surgeon in the Orange County area. And today's topic of interest is arthritis. Arthritis is something that involves joints in the entire body. My main concern is to educate and inform you of the joints of the foot and ankle. Arthritis can be caused by wear and tear, trauma, activity, shoes, and it can be genetics. Number one, to avoid arthritis, we need to walk properly. This can be done with a custom molded orthotic to offload the joints that are being stressed. One of the main places that I see arthritis is in the big toe joint, in the subtalar joint, and in the ankle. Initial treatment for arthritis, which is conservative, is orthotics, which decrease this motion, which is pronation, take the pressure off of the big toe joint, midfoot, subtalar joint, and ankle. When joints have arthritis, they have limitations in motion. When that happens, the patient has pain. If you have pain, you walk differently. When you walk differently, you're placing weight on areas that should not be placed. So what the orthotic does is it increases the surface area of the foot and offloads areas and odd loads certain areas, taking the pressure off areas that I feel are arthritic and need more motion with less pain. If the orthotic doesn't work, the second line of treatment is cortisone injections to the actual joint, which could be the big toe joint, the midfoot, subtalar joint, or the ankle. If this doesn't work, then we move to surgical procedures. Number one could be the excision of bone impeding motion. This is the simplest form of surgery that can be done for a joint that's hurting with motion. If the inside of the joint is arthritic, the next treatment for this would be an implant. I perform many implants over fusions in the first metatarsal phalangeal joints, which is the big toe joint, because I believe that movement is important. Some people prefer not to do an implant and use it and do a fusion, which is completely okay. But I think that implants maintain motion, and our goal as foot and ankle surgeons and podiatrists is to maintain motion and allow the person to walk effectively and comfortably. The next step after the implant would be a fusion. Basically, a fusion is when you remove the actual joint, you put the joint back together in the proper position. With plates or screws, you discontinue movement in this joint. The problem with fusions is that if one joint doesn't move, it places more pressure on the surrounding joints, causing more pain and arthritis in those joints in time. Therefore, if we're dealing with the first big toe joint, in my opinion, implant is beneficial because it encourages motion, allows the patient to walk, and does not put pressure on the surrounding joints. The most important thing I want to get across to you is that if you're having pain secondary to arthritis, you're compensating, you're putting pressure on other areas that should not have the pressure placed upon. So, if you're having this pain, you should consult a physician, and you should definitely seek treatment, whether it's conservative with custom molded orthotics, injections, or implants, or possible fusions. To find more information, contact us on www.orangecountyfootandAnkle.com. Thanks for joining us.